Members of the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus held their annual winter conference in Albany last weekend. For those who don't know, the caucus has a lot of political power in Albany. They led the charge on criminal justice issues in recent years, but their legislative agenda is a lot more than that. And this year, it includes a push for more funding for safety net hospitals in the state budget. Those are hospitals that primarily serve low-income communities, where many residents are either on Medicaid or uninsured altogether. In New York City, they serve about half the city's population, according to lawmakers. And most patients, they say, are from communities of color. So when those hospitals don't have enough resources or funding or staff, that can have a disproportionate impact on the state's most marginalized communities. And caucus members say Governor Hochul's proposed budget plan is at least $700 million short on funding for those hospitals and want to see a deeper investment from the state. Assemblymember Carinas Reyes, who's actually a registered nurse herself.
The money is not there to continue to serve the community, and we need to start ensuring that our safety net hospitals survive. Because if they close, if the hospitals in our communities close, the impact to the health of our communities is going to be so detrimental that there won't be enough resources in our state to compensate for it.
And some lawmakers say that safety net hospitals should get a boost of at least $1 billion in the budget. But moving on now to a new segment we're calling New York by the Numbers. It's a segment we're going to use to tell you about something at the Capitol using a number. This week, that number is 8.5. You might remember last year when human service workers were seeking more funding from the state. Those are workers spread across a bunch of fields, including care for people with disabilities, certain mental health care workers, and more. And in last year's state budget, they got a funding bump of 5.4%, which was about half of what they asked for. That brings us to 8.5, specifically 8.5%. That's how much more in funding those workers want to see in this year's state budget to raise wages higher for staff to combat turnover and keep up with inflation. Senator John Mannion, a Democrat, chairs the Senate Committee on Disabilities.
They should not have to make decisions about providing for their family and providing care that's based on trust, that's based on respect, that's based on relationships. It is a vocation for our DSPs, and we have left them behind.
Governor Hochul's budget plan includes a 2.5% increase, which workers say is not enough. More on that as budget talks continue. But sticking with health now, advocates are asking Governor Hochul and the legislature to undo a Cuomo-era Medicaid change that they say will end critical services for underserved communities. It's a bit wonky and in the weeds, but 3 years ago, the state was trying to find ways to cut costs in Medicaid. And one change that was approved would affect community health care providers under a federal program called 340B. That program allows those providers to get prescription drugs at a discount, as long as they use those savings to provide more services to their communities. But the state wants to make a change in Medicaid that would end that, and then try to fill that gap some other way. They say it will save the state money and make the Medicaid program more efficient and easier to navigate for beneficiaries. And the thought is that if it saves the state money, some of it could be reinvested in those communities, but that's not guaranteed. The change is set to take effect on April 1st, but Senate Health Chair Gustavo Rivera says he wants to stop that from happening.
But then the impact that it would have on the providers who use this program as a way to save money and, more importantly, invest those savings into the lives of vulnerable populations, it made all the difference, as it is the reason why for the entirety of this, since this was proposed, I have opposed it and I will continue to oppose it.
We'll let you know if anything changes there.